Welcome to Tea with Tanya podcast. Every week, I'll be brewing up a perfect blend of public health stories, which will include maternal and reproductive health, career and academic advice, self-love, health, and wellness tips. Join me, your host, Tanya. I'm a public health professional working in maternal health. I'm a birth and postpartum doula, a placenta encapsulation specialist, and certified lactation counselor by day. And I'm your average tea-loving millennial and content creator by night. So pour yourself up a cup of tea and join me in the tea tasting room for your weekly dose of inspiration, where you are the center of our conversation. This podcast is here to serve you. So come take a sip with me and let's start promoting positive living together. All right, hey guys, welcome back to another episode of Tea with Tanya, and I am joined by someone very special to me. I met her over social media. So you guys know I always say the power of social media. Sometimes we can use it for bad, but it's always good when it's something positive that can come from utilizing social media. And I met our guest today a few months ago when I reached out to her asking her to be a guest on my nonprofit's Instagram Live series for Period Poverty Awareness Week. And I was nervous to ask her this time around for the podcast. But I was like, you know what? In this life, we have to shoot our shot, or we have to ask these questions. There's going to be one answer. It's going to be yes, or it's going to be no. And ultimately, she said yes without hesitating, guys. So I'm just going to have her come in and tell us a little bit about herself. Nurse Janelle, thank you so much for being here with me today. And it's been long overdue.
Yes.
Well, we made it work.
Yes. Thank you for your patience. And thank you so much for sharing your other platform with me. I really appreciate it.
Thank you. Happy to have you here. So as we do it here, tell the listeners a little bit about yourself and what got you in this position.
Oh, my goodness. So again, yes, my name is Janelle. I am a registered nurse. And so my journey to becoming a nurse it wasn't linear. I actually started out working initially in public health. So I have a lot of degrees, but initially I went to school. I'm from Canada. So I went to school and I thought I was going to work in the front office of a sports agency. I really liked sports. And then my initial degree was in sports management. So I was like, I'm going to work for the Raptors. And between my undergraduate degree and going for my master's, I got this job at a local health department, and it was working with children's and implementing a school project focused on health and physical activity. And so I was like, okay, this is kind of cool. This will serve its purpose for the couple months in between going from undergrad to graduate. And I ended up falling in love with it. And then little did I know that was actually public health, what I was doing. I was implementing a public health initiative. And so I was like, I don't know what to call this. And I kind of looked it up, and then I was like, it's public. It's public health. This is what I'm doing. And so I went to school for public health. And when I graduated, I initially started doing some evaluation at a university, and then followed that up by working for the state of Ohio for about 8 years in a couple different capacities. One being in prevention. I worked for heart disease and stroke prevention, did health education for 5 years, and then transitioned into maternal and child health and did a lot of initiatives around that. And I think that's where my passion for reproductive and sexual health initially began. And I loved public health. I still love public health, and I loved what I did, but I got a little bored, and every couple of years I reinvent myself. So that's when I decided to go back to school for nursing. And so going to nursing school, I knew that I did not want to do traditional nursing. I actually wanted to do public health nursing. And so I was just fortunate enough to find positions. I have always worked outpatient and positions that were public health leaning. And so after a couple of years, I started working in young women's reproductive health and sexual health, where I did birth control, HIV testing, STI testing, vaginal health, all sorts of stuff. So that's kind of my journey. Definitely not linear, definitely, went through different gamuts to figure out kind of what I liked. And here we are.
I love that, because that's how I feel with me. I was opposite you. I started out going to nursing school, and then after I ended up failing out, I was like, what can I do now? And then that's when public health came on my radar. So, my public health heart is smiling at you because, I think for me, my goal is to always let people know that public health is our everyday life.
Yes.
So then to see how that's how you started and where you are now, that's so important. But I do want to ask, because fun fact, guys, she has a Caribbean background, or as we say, Caribbean background by way of Jamaica.
Yes, ma'am.
And I know sometimes when you grow up in a Caribbean household, they want you to be, you got to be a lawyer, doctor, teacher, something along those lines. But public health, when you think about public health, that's not something that they're going to tell you, oh, you know what, you need to go do public health. You got to be a nurse, you got to be a doctor, a teacher, lawyer, even an accountant. So would you say your upbringing influenced your career path in any way?
So the good thing, my parents are they're Jamaican, right? So they didn't leave their country to go to some cold country for you to be nothing. That's the kind of Jamaicans they are.
Okay.
And so the thing about them is that I have two other siblings and they've always been very supportive. Their one thing is everybody has to have a higher education. So everybody got to go to college or university, a trade school, something. The thing about them is that they were very supportive in anything we chose. So they've always been like, you can choose whatever you want to choose. You just have to be able to support yourself. Because once you're out, you're not coming back in my house.
Okay.
The fact that I chose public health, they didn't know what it was. They knew that I've always liked health.
Yes.
When I graduated and was able to, find jobs and careers and make, I was making very decent money in public health. I've been very, very blessed.
Mm-hmm.
So they were just happy that I had found something that I truly liked.
Well, that's good to hear. And guys, as you heard her said earlier, she has a very, very deep passion for reproductive health, which includes sexual health, vaginal health or vaginal health, tomato, but we say vaginal health where I'm from or how I was raised. So I'm going to use that word. And to be honest, guys, and Nurse Janelle, even though I'm about to talk about sexual and vaginal health, me saying the word sexual, me saying the word vaginal, I'm like, it's still somewhat
cringing.
Again, we grew up in a Caribbean background, talking about sex, talking about our vaginas, or even periods, whatever it is as it relates to reproductive health, wasn't something that we talk about, or we talked about, or even we talk about in 2022. That's not something
True.
that we normalize. So me having this platform and coming to you, asking you to be a guest, I'm like, Tanya, what did you get yourself into? Because now your parents are going to hear this. Your friends or people back home who know you when you're a little girl are going to hear this. But then if not me or if not you, Nurse, then who are we? Who's going to be the one to educate us about our bodies? So I do want to ask this question. In reference to our vagina, how should things look and how do we distinguish the difference between, let's say, ingrown hairs, balls, hair bumps, infections, or these different things when it comes to our vagina or vulva? But I'll let you...
Vulva.
Yes.
So here's the thing. It's very controversial. Your vulva is actually supposed to have hair. There's a reason that it's supposed to be. So if you have a vulva with hair, that's perfectly acceptable. It does its job. It's there to protect your vulva, which is very, the skin is very sensitive. It's there to trap debris, prevent infection. Mm-hmm. So the thing about your vulva, you should actually look at it to make sure that you know what it looks like. So you know what your baseline normal looks like. And so if you are finding that, you have little bumps that really look like red, hot, inflamed, that could be a sign of an ingrown hair. With people of African descent, our hair is curlier and even curlier down there. So we are more apt to having ingrown hairs just because of the way the hair grows. It's curly, so it can curl onto itself. You should be looking for any spots that haven't been there, any itching or discoloration, anything like that, anything that for you is not normal. So what you need to do, the first thing you need to do is know what your normal looks like. So if you can feel bumps or if it looks different, that would be cause for concern and something that you should definitely follow up with your provider about.
All right. And as far as our body parts, how can we normalize talking about our body parts or calling them by their right names? Because I now live in the South and I've heard some names that, even growing up in Antigua, I've heard different names too, but living here in the South, I've heard some names that I didn't even know existed. So why is it that it seems like in society, we sometimes lean towards calling our private parts or, bodily parts a different name than what's actually given? So what would you recommend or what would you suggest us doing to normalize saying the word vagina, saying the word penis, saying the word breast out in public without feeling like myself here cringe or being ashamed? So what are some things you would recommend us doing to normalize that?
doing exactly what we're doing, which is talking about it, saying the actual word. Even I have a daughter and she's 8, so I use like the anatomical name so that we get used to saying it. I mean, sometimes it's my husband just looks at me and he rolls his eyes, but you have to call it by what it is. Like the more that we talk about it, the more normalized it has become. Like I'm kind of glad that I live in the media, the area of social media, just because, there are more discussions happening about our different body parts. People are naming them at their actual names. So the
Yes.
more that we talk about them, the more that we just continue to use the proper names. I'm hoping eventually that it just becomes normalized. But the only way we can do that is by having actual discussions of using the proper anatomical names and not feeling that shame or stigma associated with it.
Right. And I know you mentioned you have an 8-year-old daughter. So my question to you is, what is an appropriate age range for us to introduce the topic of, again, talking about your body parts without it? I have nieces and nephews, from 6 on to 12. And, I want to know how I can go about normalizing. I mean, I do talk to them about, this is your vagina, this is your penis, XYZ. But again, for other people listening and even for us who have friends, what is an appropriate age range for us to introduce the topic of, this is your vagina, this is your breast, or consent, or good touch, bad touch? Because within my organization, Scrub Life Case, we do talk about that. We had an event earlier back in July when we spoke about what is consent, how to advocate for yourself, even though you're 6, 7, 8, because children these days are way more advanced than I was.
Yeah.
When I was that age. I don't know what I'm trying to remember. I was just having a conversation like, what was I doing at 9 years old?
Playing with Barbies, playing with dolls, right?
Probably. I remember, I think I remember at 10 years old, I remember having a pain in my chest and my mom telling me, oh, you're going through puberty, you're getting breasts. Not that I have any much bigger than since then. So I'm like, did I finish puberty? But, that's besides the point. But, like what is an appropriate age range for us to introduce the topic of these body parts and puberty and even menstruation to our up and coming preteens without it being, stigmatized?
I think the younger, the better. Like kids are curious by nature. And especially, I just remember my daughter when she was a toddler. I can't remember how old she was, but she she asked me something related to her vagina. Like she wanted to know where the pee came from. She was like, where does my pee come out? And so I was like, okay, this is a great opportunity to show you. So I had her lay on the bed. I like kind of had the mirror and it's like, okay, so you see this hole right here? This is where my husband walked in, he's just rolled his eyes and walked back out. But you're supposed to have those discussions. I personally feel like the younger they are, the more superficial their questions are. So you can provide answers that aren't too deep. I feel that you do a disservice to your child if you don't prepare them or at least initiate the conversation about puberty and body changes before it actually happens. And so if you are not comfortable doing that, there are like a plethora of books that you can have. And, me and my daughter, we reading some period book right now and she's really into it. You can always use your pediatrician to have those discussions. There's always a mom in the group that's okay and open to having these conversations about body parts. You have a friend in the group. But I think the younger you are, the younger the person is, you provide that information in a way that's easy to understand. And as they get older, you just keep building onto that. But it should be an ongoing discussion that you're having so that they're used to coming to you to have these discussions. They're well informed about everything. You can use your resources, other parents, other girlfriends, pediatricians, just to have these ongoing conversations.
And I think with that too, it also creates an open dialogue just throughout life. Because sometimes if I can feel comfortable talking to my mom or my dad about certain things, then, it prevents your child or children from maybe lying or thinking that something is wrong. And then I know growing up, we probably did things behind our parents' backs because, we were scared to go talk to our parents about a change in our body or something someone may have done. So that's a good thing. And again, for those of you who listening here, we can start as early, whatever questions they have, don't shy away from answering, just give them the response that's age appropriate for them. Or if you don't feel comfortable, you can call a sister or a friend. As Nurse Janelle said, there's somebody who's willing to be as bold and open to answering those questions. And I want to shift gears a little bit about how to clean our vagina. Now we say vagina, well, we know the correct term is vulva. So maybe if you can give a brief difference or description between the vagina and the vulva, and then we can give them tips as to how we should be cleaning our vaginas. Because I remember, I think it was, if it was not on the live with you or probably a live somewhere a few years ago, someone was talking about, oh, this is how I'm cleaning my vagina. And they were like in their 30s. And I'm not opposed to learning, because even though in my day job I do work in maternal and child health, I am not opposed to learning. I'm always researching because I don't know everything, and I need people to understand that we don't know everything. Doesn't matter how old you are. There's always room for learning. So definitely describe the difference between the vagina and the vulva, and then how we can properly and effectively clean, or should be cleaning, our vaginas or vulvas.
So the vulva is the outside part, anything that's visible. So if you were to take a mirror and look at yourself down there, that outside flesh, that is your vulva. The vagina is actually the inside. So, where you insert a tampon, where your baby comes out. In terms of cleaning, so I like to say this, like if you are using products or doing it a certain way and you're not having any issues, so you're not having any infections, there's no itching, there's no burning, nothing is happening, continue to use the same products, continue to use the same procedures. Now, in terms of how to clean your vulva, that area, the skin is very sensitive. And so what you're supposed to do, you're not supposed to overwash it because that can throw off the pH. So really, you're supposed to do it once a day. You're technically really only supposed to use, your hands and a mild cleansing detergent, because things like loofahs and, washcloths, things like that, they can hold bacteria. And so you're introducing bacteria into an area that's already sensitive that can cause a host of problems. Your vagina, you're not supposed to put anything in there. So you're not supposed to douche. You're not supposed to put any soap in there. You're not supposed to insert anything in there to clean it. You can clean the kind of like the outside of the vagina, but you're not supposed to introduce anything in there. So in terms of recommendations, it should be a mild cleanser. You want to keep it close to your vulva pH. So that's anywhere, I want to say 3.5 to 4.5, cleanser. And then kind of using your hands. You don't want to over dry it. So once a day. Of course, if you are somebody who sweats a lot, overly active, you kind of know your own body. So, if you need to do it more than that, you certainly can do that. Now, if you're finding that, you are cleaning the way you're supposed to be cleaning and, there's still a scent down there or something is amiss, you might want to follow up with your provider. You could have something like BV, which means, an overgrowth of bacteria, which can cause issues. It could be something else. It could be a yeast infection. So definitely, if you are having issues like the scent is off, or, you're having an infection or discharge or more than usual, then you definitely want to follow up with a healthcare provider.
That's interesting. So definitely, because they should not be smelling, as we like to say, or I've seen on social media, foul. So if that's the case, then that's the time. Yeah.
Right. It should not be smelling foul. Like your vulva, your vagina has its own scent. So you should know what your normal scent is, because there's always an earthy, they say a earthy scent, but it shouldn't be foul. You are correct.
So in your line of work, what are some sexual and vaginal health issues you've seen affecting millennials or just people in general that we need to pay more attention to?
Oh my goodness. STIs, that's a big one. That is a huge one. STIs. So I'm talking about chlamydia, gonorrhea, trichomonas, I've seen HPV. So the thing about HPV, like human papillomavirus, so they are a group of viruses. There's a group of I can't remember if it's 18 or something that can cause cancers or greater infections. So the thing about HPV, if you're sexually active, most people will get it in their lifetime. The thing about the human body is that most people are able to clear that infection. Some of the viruses are stronger than the others, and your body isn't able to clear them. So what happens is that can turn into pre-cervical cancer or cancer cells. And so HPV is a big one that we see. And so once you have certain pre-cervical cancers or changes in the cells, there are a couple of procedures and pathways you can go down for that. So HPV, definitely want to look out for that. If you haven't had your HPV vaccines, something you certainly want to consider if you're in that age group. The other one is sexually transmitted infections. That's a really big one. And so chlamydia for women oftentimes can go without symptoms. You may not have any symptoms. Your partner may not even display any symptoms. And so you could have this infection for a while. And eventually you're going to start, changes to your discharge. You're going to have sex is more painful. Color discharge is different. So you're going to start running into these issues. And so the things with sexually transmitted infections, if they are not cleared up, so if they're not treated down the road when you're looking to become pregnant, it can affect your fertility. It could affect your chances of getting pregnant, ectopic pregnancies. So if you're not in a monogamous relationship, I would strongly recommend using condoms. I also recommend just getting tested so you know what your status is and your partner's status is or your partner's. The thing about it is just making sure that everybody's safe if you're engaging in sexual activity.
And I'm going to add, even though you're in a monogamous relationship, you still want to get tested, as
Correct.
often as possible, because there's just no telling what one person may be doing.
Right.
But just to piggyback on one of the questions as we went to talking about taking care of our vaginas, I know we're not supposed to use maybe strong scented body oils or lotions or even soaps, but what are your suggestions, or what do you think about someone wearing a panty liner daily, or the types of underwear that we're wearing? Because I know growing up and even to this day, you're supposed to wear cotton panties or cotton underwears, and then, but they have all these little sexy panties now, excuse my language, all these different kind of underwears that people are now, you want to, I guess, look good or feel good about yourself, but they don't always have that. They don't always have that cotton lining. Well, some of the ones that I've seen, I know some do have it, but what are you taking that as far as the type of panties that we should be wearing? Should we be wearing panty liners daily? How is that affecting our pH or anything as it relates to the vagina by doing those?
Right. Panty liner, you definitely shouldn't be wearing a panty liner every day. So the area down there needs to breathe, and the better it breathes, the better everything works. So if you are wearing a panty liner daily, there's something amiss. So that's a follow. Like, you need to follow up. There's no reason to be wearing a panty liner every single day. Like, that just, it
cause for concern.
Right. It allows for more bacteria to grow down there. So what happens when you have more bacteria? Your pH is off. Things like BV come into play, things like that. In terms of underwear, it is best to wear underwear that, is produced from, like, the material is produced from the earth. So cotton is usually the best one. Not to say that, occasionally you can't wear the sexy, satin or silk or whatever.
Right.
It's perfectly fine to do it occasionally, but more times than not, you want to use or wear the underwear that's produced from some sort of earth material, which most times is cotton.
Well, that's good. So you hear that, guys? Most time it's cotton, but it's okay to wear a little silk and polyester and these type of underwear, but it shouldn't be a daily habit. Okay, so I want to switch gears a little bit, Nurse Janelle, because I am the person, and for someone who works in healthcare or in public health, when it comes to going to the doctor, I have in the past, I've lied to my doctor for fear of...
Don't do that.
That was back then when I was much more younger and naive, but still, it's not that I didn't necessarily plan on lying, but I just didn't want maybe certain tests being run, or I just didn't know, again,
right,
coming from a certain background or from the crib, and, you just don't want to hear certain things, or for me, I'm always thinking the worst as well.
Right.
So when it comes to a pap smear or going to see a gynecologist, let's say this is someone who's a preteen, a teen, or even someone who in their 30s like me, what are some questions we should be asking our provider? Because as far as like a routine, is it pelvic exam or pap smear, these different things? So I guess you can probably tell me, one, what is the right age? Because I know every time I'm reading up or doing the research, that changes. So what is the right age? Should we be getting a pap smear? And what is the reason why? And then what are some questions that we should be asking our doctors or gynecologists?
So here in the US, the guidelines for an actual pap smear. So a pap smear is a test where they're, going in, they're looking, they're swabbing, and they're looking for pre-cervical cancer or changes to your cells in uterus. And so that begins at age 21. And so pap smears actually begin at age 21. Now, I have worked with Young Women's Reproductive Health. We would do pap smears on those who were 21 and older. But for those individuals that would come in and they had some sort of issue going on down there, like they're like, oh, we have a lot of discharge, or it's itchy or something like that, you can have a pelvic exam. So a pelvic exam it's similar to a pap smear. So, they'll lay you down, they'll put your feet in the stirrups, and then they're going to open up with the speculum and look. They're not doing the swab specifically for looking for pre-cervical cells. So pelvic exams can be done. We've had individuals as young as, I'm trying to think, like 16 in our clinic doing pelvic exams, 16, 18, kind of just depends on what we're looking for. One of the things I always suggest is finding a provider you can trust. So whether that be an OBGYN, if that's a nurse midwife, if that's a nurse practitioner that specializes in reproductive health, find somebody you can trust, because you want to be able to have a relationship. You want that person to kind of know you, understand you, so that if you are running into issues, they can kind of guide you through it and say, okay, let's try this instead of this. So you definitely want to find a provider you trust and that you can go to for continuous care. The thing about going to different providers, not to say it's a terrible thing, but when you don't have that one person that knows you consistently, like we can never put as a healthcare provider, you can't put the whole picture together because there's pieces and parts that we may be missing from like your medical history that we just don't know about. So find a provider you can trust, start your pap smears at age 21 plus. You can go in for pelvic exams, starting in your teens. You can go older if that's what's warranted. Kind of just depends on what you're presenting for, like what's the issue that you're having.
And for those who don't know, because I'm going to take you back to when I was growing up, of course I know better now, but do you need to be sexually active to have a pap smear done?
No, you don't. No. So if you're a 21-year-old that presents to a clinic and you've never been sexually active, you can still have a pap smear. That it doesn't negate a pap, like you don't need to be sexually active to have a pap smear. A pap smear is just, it's like any other test you would run on your body just because we want to, get a baseline. We want to see what it looks like so that, in the event when you do become sexually active and we start to look at things and you go back for your pap smear, you can say, okay, something has changed because now we're getting these results from your pap smear instead of, what was at the baseline. So no, you don't have to be sexually active to start getting a pap smear.
And as far as creating daily habits, what are some habits that we can create to have healthy vaginas?
Daily habits. Okay. So not living in really tight clothing, like the leggings all the time or the tight jeans. They're cute. I love them. They're cute, tight jeans, leggings. But again, you want that area to breathe. Not to say that you cannot wear the black leggings or the tight pants, occasionally, but you want to wear comfortable clothes that will allow your area to breathe. You want to, like we talked about earlier, wear those underwear that's made from products of the earth. So like the cotton underwear, you want to make sure that you are cleaning it, or cleaning your vulva, cleaning your vagina on a consistent basis using, products that are sensitive to that area and procedures that warrant for that area. You want to make sure that you have a healthcare provider that you can turn to in the event that you're having issues, and also somebody that kind of has been following you along. So in the event that something arises, you have somebody to turn to kind of help you put that picture together. You want to, if you're not in a monogamous relationship and you're sexually active, you want to practice safe sex. So what does that look like? That looks like using condoms consistently and correctly every time, either the internal condom or the external condom. You want to do STI testing. And so the guidelines for young women, I want to say it's from like 21 to 34. Like you want to be tested for gonorrhea and chlamydia yearly. You want to do your HIV test. The recommendation here in the US is one HIV test per lifetime. Depending on what your risk factors are, you may want to do more than that. You can also be tested for trichomonas if that's warranted, depending on risk factors. So those are the kind of the ones that I would recommend.
All right, so let's shift a little bit to sexual health. Yes, I'm saying the word sexual and health. Tell us exactly what it means when we talk about sexual health. Because I had a conversation with someone a while ago and they were like, oh, what is sexual health? Oh, we're just having sex. These are conversations that we're trying to normalize so people can know that there is a healthy way to engage in sexual activity. So when we talk about sexual health, what can one understand what that means? Like, how can you explain that? What is sexual health to someone?
Sexual health, and it encompasses everything. So it's like the reproductive part, like so knowing your body and your body parts and how that works. It also means sexual activity, so engaging in sex that is enjoyable for you. You are enjoying it. You and your partner have that open communication. You guys are on the same page about things. Sexual health also means like consent. So consenting to having sex. It's in a way that's enjoyable for you. Sexual activity or sexual health could also be just like using things, solo sex. So in the introduction of vibrators for yourself or your partner. So it kind of encompasses a whole lot of different, in my opinion, a whole lot of different things. It just kind of depends on the individual and, their partners.
Okay, so I'm going to ask you again. How can one introduce the topic of sex to their teenagers? And I ask this question because I'm thinking back now that I'm talking to you. I don't remember if I ever had that sex talk with my mom or my parents. Maybe I did. Like I said, my brain probably is not computing that. But I remember in high school that I don't necessarily think we had sexual education in high school, but we had, a conversation was had, or I know we did things surrounding HIV and STIs. And I remember doing that, how to put on a condom, how to put in a female condom. But as far as the actual sex conversation about, besides being practicing abstinence, what else? Like, how do we? That's all we knew. Put on a condom, don't have sex, but that's it. But yeah, again,
Right.
kids are being more and more curious from a younger age too. So how would you introduce the topic of sex? Again, not trying to force, or because I remember having a conversation, sidebar really quickly, with a parent of a younger child, and I think I told them, the child was asking certain questions about different body parts, and I like this boy at school, but they were under the impression that she's too young to ask that question, or she's too young to actually like someone, or we understand that, puberty. So how do we go about introducing sex to preteens, and adolescents in today's society?
Yeah, I just like, you're introducing reproductive health. It's something that should be ongoing. And so you want to kind of start those conversations, and they're not going to be like the in-depth sex conversations with, young kids. You start them young. So when they're asking about body parts and this and that, you can introduce certain topics like consent, or the fact that your good touches, bad touches, your spaces, and, things like that. You want it to be an ongoing conversation. It is going to be awkward. I'm not going to lie. Especially with your own, you're just like, well, how do I even talk about this? This is so awkward. But you can take moments of the day, like if you're watching a movie together, or if they, the teen is saying, I like this boy. Okay, let's delve a little bit deeper. So what does that actually mean? What do you mean? What do you like about this person? Like, what does a relationship to you look like? What things do you envision doing, or what have you guys done? Like, so you take those opportunities if they're presenting them, like that's a good starting point to kind of delve into those conversations. And of course, they're going to roll their eyes and they're going to be like, oh my gosh, I can't believe I'm having this. But it's important. Like, they want this information from you. They always look to their parents first to get the information. And it can be awkward. It could be kind of embarrassing if you're not ready to have it then and there. Take a moment, take a step back, breathe, and then just reintroduce it later. But in all honesty, and teens are really looking to their parents to, first and foremost, to have these conversations. If you don't know what to say, of course, you can turn to their pediatrician or their nurse practitioner to kind of give you cues and to help you along this journey. But it's definitely something that should be ongoing, and it's something that they want to have with you.
All right. And next big question. Should sex be painful? Which we know the answer to that, but should sex be painful? And what are some common reasons that would cause sex to be painful? And when should we see our provider if that's the case?
So sex should not be painful. The first couple of times you do it, or if you like, it might be uncomfortable, but it shouldn't be painful. So if you are experiencing pain during sex, it could be it could be like an infection. It could be something structurally down there that's going on. It could be something psychological, like something from your past that is preventing you from relaxing those muscles. And so if you are engaging in sex frequently and often, and it's painful every single time, that's definitely something you want to follow up with your provider with. Sex should be enjoyable. It could be awkward sometimes. It could, get in your rhythm, new partners, things like that, but it should never be painful. So if you are experiencing pain, that's definitely something that you want to talk to your provider about.
And what about sex on your period? Because that has been a topic that I've seen across social media in recent time, especially TikTok. People are having sex on their period. So what are your takes on that? Like, why do we, again, I understand, but for those listening, why, what hormones are involved as to why we're feeling frisky during that time, and then people are actually, or would want to partake in having period sex? So what are your takes on that, and what can you tell our listeners about why they may be feeling that way at certain points in their cycle?
Yeah, because, your reproductive cycle, or your period cycle and menstruation cycle, is regulated by hormones. Like, we are hormonal individuals. And so depending on where you are in your cycle, something's going to drop, like your estrogen drops, and then your progesterone takes over, and vice versa. And so when you're on your period, some people, that's the time that they feel the most first, like that's when they're most aroused. And so there's nothing wrong with having sex on your period. If your partner is into that, you're okay with that. It's perfectly fine to go ahead and do that. Some people are like the opposite, like during their period, like, nah, I'm good. I'm bloated. I don't feel well. Like, please
Don't
don't
touch
touch me.
me.
And that's perfectly right. That's perfectly fine. Okay. So it's based on everything is individualized, not because everybody's doing it on TikTok. Should you decide that I want to do it too? If that's not what you're into, like, it's perfectly okay. But like, nah, I'm a pass on that one. But if it's something that you're open to, like, yeah, I'd like to try that, have the conversation with your partner and see how it goes. But it's perfectly okay and acceptable to have sex on your period.
Right. And do we think that birth control, and then we'll talk about probably the types of birth control, but do you think birth control can affect one's sex life probably in a negative way or just in general?
It can, depending on the type of birth control. Of course, you got to remember that, our cycles, our sexual health, our reproductive health is influenced by hormones. So, progesterone, estrogen, whatever. And so you're taking these hormones, synthetic hormones in your body. And so for some individuals, it doesn't necessarily, the hormones that they're ingesting doesn't match up with their natural flow of their own hormones. And so some people it can dampen their sexual excitement. It can make them kind of not want to have sex, things of that nature. It can make their, like, even if they're trying to engage in sex, it can dry them up depending on the type of, birth control you're on. And so, yeah, it can negatively affect your sexual health. And so if you start a new hormone control therapy and you're finding that, like, it has changed your libido and, your sexual prowess, that's something that you definitely want to talk to your provider about, because they can be like, okay, well, we tried this. Let's try something else for you. Let's try this. And so the thing about birth control is it's all individualized. So whatever you're taking, it may be different than what your best friend's taking.
Right.
Like, this may work great for her and it may not work for you, because it's very individualized. And it may take some time for you to find that perfect product for you and for your body and for what you need.
Well, that's good, because I had an issue and I was wondering, I'm like, well, let me see, but it just comes down to knowing your body at the end of the day. So I have some questions here, and I'll pull these from your blog, guys, and I'll put that in the show notes. If you haven't checked her website out, make sure you do that. And it's called Questions We're Too Embarrassed to Ask About Our Vaginas, right? Question number 1. Why does one of my labial lips hang lower than the other? And guys, I know you've probably asked these questions. You've seen every, it's different. So why does one of my labial lips hang lower than the other? Nurse Janelle?
I mean, everybody's different, right? Everybody's different. So your body is going to present differently. And so for some people, that's having one labia that's longer or shorter than the other. There's idiosyncrasies to everybody's body. And just because one is longer or shorter than the other, that doesn't mean there's something wrong. It's just, that's you and your body. So again, you're perfectly normal. Everything is okay. It's just different because your body is different than, say, your sisters or your best friends.
Right. All right. Is it okay that I don't have an orgasm every time I have sex? I just asked that question, but I just did.
If you're okay with not having an orgasm every time you have sex, sometimes, you're just doing it. You've been married for like 25 years. Your husband, significant other, asks you and you're like, all right, let's just do this. And you're okay not having an orgasm this time. But, if it is important to you every time you engage in sex to have an orgasm and you're not, okay, that's a problem, right? You're not being sexually fulfilled. So that's definitely a conversation that you need to have with your partner. Maybe like what worked in the past is not working now, especially as you get older. Like, things change, right? What did it for you in your 20s ain't doing it for you in your 40s. So things change. You need to have that conversation. And if it's not your partner, it's not you, it could be like a medicine, like as older you get. And so medicines can affect your libido, right? And different medicines can affect that. So that's something you can definitely want to talk to your provider about. It could be something psychological. You're more stressed. You're trying to balance work and kids and the economy, right?
Yes.
Your 401k, everything. So that can change how you feel sexually. So there's different reasons why a person may not have an orgasm every single time. If you are okay, like you have sex 12 times a month and you didn't have an orgasm once and you're okay with that, that's fine. But if it's something important to you, you're like, well, I know that every time I have sex, I have an orgasm, then you start to look at different things, partners, medicines, stress in your life, different things. And then you have those conversations with the parties that are involved.
Right. Okay. Next one is spotting after sex. Is that normal?
It depends. I don't know if that's a right answer. And so, okay, so if you are a healthy individual, everything is okay, and you have spotting after sex, it could be because the sex was a little bit rougher this time and it's a one-time thing. But if it's something where you're continuously having bleeding after sex, that shouldn't be. And so that's when you want to follow up. So like, is it an STI? Is there something else going on down there? So you want to know your body, of course, and know your baseline. If it's a one-time thing, it may just be because of your position or your partner, new partner, bigger partner, whatever. So that's something to look at. But if it's something that's kind of ongoing and you're spotting every single time after sex, okay, that may warrant a trip to your provider to kind of see what other factors could be in play.
All right. Next one is, should we really be shaving down there? Should we have a lot of hair? Like, what are we doing down there? Let's try and end that debate. Should they be hair or no hair?
So the hair is there for a reason. Like, it doesn't grow because, it's trying to inconvenience it. It's there for a reason. So the hair on your vulva is there to protect the skin. The skin is very delicate, has a very delicate pH. And so the slightest thing can throw it off. So the hair is there to prevent debris, to make sure your pH is balanced, everything like that. Now, I will say that like it's supposed to be there, but if you have shaved forever, you don't like the hair down there, it gets sweaty, it smells, whatever, and you're taking precautions in terms of how you're getting rid of the hair, and you're not having any issues. So no ingrown hair, no infection, nothing is your pH, it doesn't smell, anything like that, then you can continue to do that. But the hair is there because it's supposed to be there. There are no health related reasons why you should get rid of your hair. Not to say that you cannot do it, but health-wise, you don't have to get rid of the hair.
All right. And can having sex and get a UTI from having sex? And why is it suggested or recommended that we pee after having sexual intercourse?
Yeah, you can get, and I've had a lot of patients who do experience UTIs after sex because of the introduction of bacteria, because of how the female body is wired and shaped. And so you could introduce bacteria into your urethra just because of where the urethra is in relation to our vagina. Everything's kind of like close together, right? So it's very easy for bacteria to get into there. And so the suggestion to pee after sex, that kind of helps to flush out any of the bacteria. Not to say it's going to help 100% of the time, but when you pee after sex, it helps to flush out any bacteria that could have been introduced into your urethra.
Well, thank you for asking those questions. I still can't believe that I was the one that was asking you those questions. But definitely, I know it's, some things I knew, some things, you learn. Again, I'm always about learning daily because I think none of us ever really knows every single thing. So I do want to thank you for that. And thank you for the work that you do in this space because, we're trying to normalize talking about our vaginas, talking about sex, talking about every single thing. That way we can, I guess, increase or even our life expectancy in society, because these are things we talk about. Oh, I'm going to the doctor to get health, or I'm focusing on my mental health, but reproductive or sexual health, that's also, a part of our health, our overall health. So we can't just talk about, oh, I'm going to see my doctor just for this one diagnosis, or I'm going to see my gynecologist. Yes, you're going to see a gynecologist, but it is, it encompasses everything as it relates to health. We can't talk about health but not getting checked at the gynecologist. Yeah, it can be scary and intimidating, but again, at the same time, it's something that we should be focusing on and be teaching even from a young age. Again, as you say, we start at the level that every adolescent is at before, of course, bombarding them with anything that they're not ready to understand, because we know how our brains work.
Right.
At 11 or 12, I was not ready for a conversation about,
you're not trying to hear it.
Like, no, I'm trying to go play sports and live a carefree life. Shoot, I would like to go back to being 12. There's no bills, no stress in the world. Just get up, go to school, and that's it. But that's not where we are. But I know your work does not define you. So where do you envision yourself? Totally off topic, but where do you envision yourself, let's say in 5 years?
I keep telling my husband, like, I want to be a stay-at-home mom without children. He's like, that's not happening. What I really want to do, I think I love what I do in terms of like educating, especially and helping people understand their bodies and how to advocate for their health. Mm-hmm. And so I would I envision and I want to see myself doing more of that work on a broader scale on an everyday basis. I did the work that I do on a clinic is very important, but I think it's important for us as Black women to continue to use our voice to amplify, reproductive and sexual health and sexual issues that are specific to us. And so I envision myself using my clinical knowledge and, my public health knowledge to just continue to do this work and do it in a bigger, broader space.
I love that. I love that. And what empowers you to be your best self, both personally and professionally?
That's a good question. What empowers me? The older I get, I think the more, centered I'm becoming, which means that, I'm all right with myself. I've learned to nothing is ever going to be perfect, but you learn to balance, your own beliefs and what you want for yourself with the responsibilities of those of your family, with the responsibilities of work. And so I think that just learning how to center myself and put my own beliefs and wants first and foremost to give my best self so that I'm able to help everyone else. I think that's what does it for me.
And what is one word or quote that is driving you or inspiring you right now in this current season of your life?
I can do hard things. I think that's the mantra that I've been using.
I love that one.
It's everything is different. Like the way that we work is different. The way that we relate to people is different. And so things I feel like as the older I get, like things that I used to do without a thought have become like scarier sometimes. I'm like, well, I know that you've done this in the past. You can do hard things. It's, you just got to try, put yourself out there. And whether you succeed or fail, like there's always a lesson from it. And you just use that to continue to grow and to become your best self.
I love that. I'm going to put that up somewhere in my room. I can do hard things because sometimes, we don't believe we can, but we're here for a reason.
Right.
And it definitely was not easy. So we can definitely do
exactly
hard things. But Nurse Janelle, I want to thank you for taking the time out of your busy, busy schedule. You guys, this woman is busy, okay? She stays booked and busy while she's saving the world to make sure that our society is advancing. So definitely want to thank you for joining me here today. And, of course, let people know where we can find you. What you got going on?
Yeah, I want to thank you so much for, sharing your platform. I'm always, the thing about me, like if you say you're Canadian or you're from the Caribbean, I'm always going to give back. Like whatever I'm doing, I'm going to give back. Like, let me find the time to do this. You're my people, right? And so
Yes.
In terms of where you can find me, I'm always on social media. I took a break for a while because it can be a little bit overwhelming, but I'm kind of back on there. So you can find me on all social media platforms at the Nurse Note. Just getting ready to write a couple of, articles for different clients. And just thinking of my next big project for myself. I haven't decided what that is yet, but, just putting some feelers out there and figuring out what's going to work best for me and, my brand. So I appreciate, though, you sharing your platform. And as I always said the last time, like anytime you need me, I'm going to be here and help you. I mean, we can only amplify the message by doing it together.
Yes.
Yeah.
She meant that because when she said that on the Instagram live, I was like, I'm going to hold her to that. And I did. And like I said, she replied and the answer was yes immediately. So I definitely want to thank you. And thank you for the work that you continue to do. And of course, we will be in touch. And I'm looking forward to seeing what you do. And I'm probably sure going to have you in here doing something else for me.
Of course. Not a problem.
Collaborating and working along with you. So definitely want to thank you. And
All right. Thank you.